I'm Dr. David Sultzer, professor at UC Irvine, and I help lead the clinical core of the UCI Alzheimer's Disease Research Center. I'm here for the next UCI Mindcast Truth or Myth episode. Today's episode addresses the question, there are no treatments available for people with Alzheimer's disease. So, truth or myth? If you answered myth, you're correct. Many people believe that Alzheimer's disease is, quote, untreatable. In fact, at this time, Alzheimer's disease is not entirely preventable nor entirely curable once someone has memory difficulties or other symptoms as a result of Alzheimer's disease. However, some interventions have clear impact to either reduce the risk of developing symptoms or to help improve the symptoms once they develop. Alzheimer's disease is not fully preventable, but we now know that certain lifestyle strategies and control of medical conditions can significantly reduce Alzheimer's risk. In fact, about 40% of the risk of Alzheimer's disease involves factors that are modifiable over the lifespan. These factors include things such as limited education, heavy alcohol use, head trauma, smoking, high blood pressure, depression, social isolation, and physical inactivity. While altering some of these factors is certainly not simple and requires a consistent approach over time, they can be addressed and reduce Alzheimer's risk later in life. In the more traditional sense of treatments for Alzheimer's disease, beyond risk reduction, there are several medical approaches to help improve the symptoms. Medications in the cholinesterase inhibitor category include donepezil, rivastigmine, and galantamine. Such medications are prescribed for those with clear symptoms of Alzheimer's disease. Many studies have shown benefit with these treatments, although the magnitude of benefit is modest on average, and individuals may respond more or less than average. And these medicines do not unfortunately arrest the difficulties of Alzheimer's disease, but can improve symptoms for a period of time. Most people don't experience side effects with these medicines, but some may have some stomach upset, and they're prescribed carefully for those with some heart conditions. Similarly, another medication, memantine, may improve symptoms modestly in those with moderate to severe symptoms of Alzheimer's disease. Going forward, there are over 100 medications currently being studied for the prevention or treatment of Alzheimer's, so we will all likely see new opportunities soon. Aducanumab is a new medication that can help remove abnormal amyloid protein from the brain in those with mild Alzheimer's symptoms and was recently approved by the FDA for use in the United States. There's still work to be done to understand whether this specific medicine can help with memory, thinking, and ability to take care of home activities, but medicines like this will likely soon be available with increased ability to prevent or better treat Alzheimer's disease. Finally, many people with Alzheimer's unfortunately develop neuropsychiatric symptoms such as depression, anxiety, apathy, sleep problems, or in some cases, false beliefs or agitated behaviors. These symptoms of Alzheimer's can be as distressing or more so for patients and families compared to the memory difficulties. Many of these symptoms can improve with a person-centered behavioral intervention that is developed with the patient, family, and the healthcare team. These interventions help to address the experience of the person with Alzheimer's and the distress among carers with some environmental adjustments, education, and adjusting social and daily living activities. While there aren't specific medications to treat these symptoms in Alzheimer's disease, doctors sometimes prescribe psychotropic medications that are used for similar symptoms in other conditions. So, while there isn't a cure for Alzheimer's disease, there are interventions that can help prevent or treat the symptoms of the illness, and novel opportunities are on the horizon. And currently, people with Alzheimer's can certainly enjoy time with friends, family, and very meaningful life activities. I hope you find this overview helpful and you tune in for future UCI Mindcast episodes. Thanks.